So, because you already have a time schedule next, so we have a very less time. So before I move to my next question about pregnancy, I actually would like to ask you one question that mostly generally people shy, in asking. So, but which actually comes to I think every men and women's mind. So, how is sex safe? How is sex during pregnancy? Is it safe or unsafe?
See, sex is safe during pregnancy. There is no contraindication for sex. Generally, it is said it should be avoided in the first 3 months. Yes, it should be avoided in the first 3 months because that's the
Okay.
time baby grows, and there are more chances of abortion in the first 3 months.
Mm-hmm.
I'm not saying you cannot do sex in the first 3 months, but
Mm-hmm.
as less as possible. Then second trimester is the best period of pregnancy. It is called the
Mm-hmm.
honeymoon period of pregnancy. So you can have sex in the second trimester. There is no problem. Then
Mm-hmm.
again in the last trimester, in the ninth month, sex should be avoided.
Okay. Okay.
Before that, you can have sex. There's no problem. In first 3 months also you can have sex. But in some females, there's complaint of bleeding during pregnancy. So in
Mm-hmm.
those cases, we tell them to avoid sex, or the patients which is conceived with IVF, like test tube baby and all,
Yeah.
if conceived with treatment, natural conception is not occurred for that. For that patients, we ask them to avoid sex. Otherwise, it's safe. There is a myth
Okay.
that sex should not be done.
So please educate the audiences about C-section and vaginal delivery.
See, vaginal delivery is the best. Everybody knows.
Okay.
Even the gynecologist say vaginal delivery is the best.
So as a
And
doctor, you would recommend vaginal delivery.
vaginal, definitely.
Okay.
I'll go for a full trial for vaginal delivery unless and until patient gets exhausted or there's some complication or the baby is
Mm-hmm.
compromised. Unless and until that is happening, a vaginal delivery should be done. So my first preference will always be vaginal delivery. Now there are some females nowadays. In our generation, the females have a phobia regarding vaginal delivery. They are very
Mm-hmm.
like they can't bear that pain.
The
There
pain,
are
yeah.
other options. There are options. We can go for painless deliveries. There is painless delivery. There is an option for painless delivery, vaginal painless delivery.
Mm-hmm.
So my first preference will always be vaginal. C-section is only when there is some complication.
But doctor, you're saying that that in today's time, in our generation, the women they normally go for painless vaginal delivery. So, but what complication does those painless deliveries have afterwards? I mean, it might get painless during the process, but afterwards, does it lead to any consequences?
No. Post-delivery, there are no consequences. But
Okay.
yes, the women who go for painless vaginal delivery, there are increased risks for cesarean section because some
Mm-hmm.
women stop perceiving pains. Like in painless
Mm-hmm.
delivery, you get contractions, but you don't perceive pain. So some
Yeah.
women don't push only, like they don't experience pain also, and they don't experience contractions also. There's a high risk it ends up into cesarean section. But
Mm-hmm.
post delivery, there are very minimal complications, like negligible, not
Okay.
much
Okay.
complications.
Hmm. But as per the word of mouth, people normally say that the C-section actually harms your body in a lot of ways. I mean, vaginal delivery, you might get recovered very soon, but in C-section, you might take months and months to get the recovery. So, is it true or is it just a myth?
See, it is like the people have created an hype, like C-section takes months and months to recover. It is not so. I have also undergone cesarean section only, but I started working after a month only. So that is a
Mhm.
myth. You can work as early as possible you want. Like approximately on day 8 or day 9 of cesarean section, a female can start doing her normal natural routine work. She should take rest, but then there is no contraindication to work. She should not work or cannot work. She has to lie down all the time.
Yeah.
This is not true. So during vaginal, Yeah, there is some difference because in cesarean section, the whole abdomen is opened. You undergo anesthesia procedure. So there
Yeah.
is a little difference, but this is totally a myth that cesarean section women's experience a lot of complication afterwards. Complication can occur even after normal delivery also.
Yeah. Okay. So it depends from body to body and person to
Body to
person.
body.
Yeah.
That's it.
Okay. Yeah. Okay. So, but doctor, you actually said that you would recommend, as a doctor, you would recommend, vaginal delivery to the women. But then, if both the deliveries are normal and if both the deliveries are okay, and you can choose either, then why, as a doctor, would you recommend vaginal delivery?
There's a less hospital stay in vaginal delivery, the discharge in a day or two. There's more
Okay.
hospital stay in cesarean section. So psychologically also patient gets frustrated staying in a hospital for more than 2 or 3 days. So for baby also, actually, the main fact comes when baby comes. In vaginal delivery, the mother can feed the baby earlier. Like post delivery, immediately post delivery, she's able to feed the baby. She can move her body herself. She can sit. She can
Mm-hmm.
move. But post cesarean, she cannot feed immediately. She needs a day or two to, like, to recover herself, to sit, to
Yeah.
her body. So it's very beneficial for baby actually. The milk production occurs very early in vaginal delivery. Cesarean section it is delayed. For baby also, when baby comes through vaginal delivery, it's a natural process. So whatever the
Yeah.
molding should be there, it occurs during vaginal. In cesarean section, the baby is directly taken out. So whatever complications could be avoided are not avoided during cesarean section. It's mainly
Mhm.
for baby that vaginal delivery is better than cesarean section.
Okay. But are there any risks involved in the vaginal delivery that a woman should be aware about
Yeah,
before?
there are risks. There are
Uh,
risks like post delivery. There is a risk of tear. Vaginal tears can occur. There can be a lot of bleeding. TPH, postpartum hemorrhage can occur. Sometimes we go for a vaginal delivery, but the mother pelvis is not as adequate as the baby size or the baby weight. Vaginal delivery
mhm.
sometimes become very difficult. Instrumentation delivery, sometimes we require to do instrumentation delivery like vacuum delivery or forceps delivery.
Mhm.
So that is very traumatic and harmful for the baby. This occurs all during vaginal delivery. So there is a
Okay.
risk, but that risk is very less as compared to cesarean.